We have about a fifth of our young people in high school who are using e-cigarettes, and the numbers are just going up dramatically.
Studies show that teen smoking is on the rise, and now Governor Mike DeWine wants to tackle this issue by bumping up the smoking age from 18 to 21. Joining me this morning is Dr. Suprenant. He is with Buckeye Health Plan, and he's going to talk to us about teen vaping. Thank you so much for being with us, Doctor. So first, I just want to ask you, for those who don't know, what exactly is vaping?
Vaping is using a device to heat a liquid that has nicotine and other chemicals in it, turning it into a vapor, and then inhaling it.
And this is on the rise. We're seeing that this is becoming a much more popular trend, especially among younger people. So why do you think that it is on the rise?
Well, it's increasing dramatically, and there are several reasons. The manufacturers are creating devices that are very appealing to kids that can be shaped like a pen or a flash drive, so they're easy to disguise, easy to hide from parents or teachers. The other reason is that they think it's safe, even though it's really not. And it's being flavored in ways that are appealing to children, such as candy, chocolate, gum flavored, menthol flavored, that are very appealing to young people.
And Doctor, you say that it is not safe, especially for these young people to use. So what are some of those other health impacts that this is having on them?
Well, of course, virtually all e-cigarettes or vaping contains nicotine, and the nicotine itself is harmful, particularly to the young brain, but it contains other chemicals as well. Not only is vaping dangerous to the individual, but it's dangerous to those around them, because the secondhand smoke from vaping is also contains nicotine and other chemicals.
And we're seeing that this is definitely a trend that more people are leaning toward and doing as an alternative as well. So why do you think that they're even moving toward this as perhaps an alternative to smoking?
Well, many people are using it as a way to quit smoking, but studies have shown that it's really not very effective for that either. So they did a big study comparing using a nicotine patch to quit smoking and using vaping to quit smoking. What they found is a year later, the people who used vaping were more likely to not be using traditional cigarettes, but they were most likely going to be continuing to use some form of nicotine. And we would like to see people who are quitting get completely off of nicotine products.
And we're seeing this as a problem. Even the U.S. Surgeon General said that it's an epidemic that we're having. So what can parents, family members, friends do to help?
There's a great deal that they can do. So I think certainly talk to children and explain to them the dangers. Ask their doctor to talk to the children and explain the dangers to them. Setting an example is critical, so parents need to not be using tobacco products themselves. They can limit the use in the child's environment, in the home and in the car. And finally, they can talk to their school and see what's being taught in the school, and then they can reinforce all those teachings that are going on in the school.
Dr. Suprenant, thank you so much for the awareness and the education on this issue.